Turner. I am with Dementia Sherpa, and I've been doing work with people living with dementia for 18 years now. And my job this afternoon is to give you a great introduction so that I can kick it over to the delightful Marianne, who's going to talk about strategy. But who here has a person that has been recently diagnosed, like within the last 6 months or so?
Okay.
Pretty much everybody? Okay. Who's feeling like they need kind of a hug?
Me.
Nobody? Okay, yeah, a few people are like, yes, that is me. Okay. So one of the things that I like to really emphasize is, you know, it is hard to hear people's good ideas when you're feeling like, oh my God, the whole world is just flipped upside down, right? So I would ask you to, let's take a giant deep breath. And then when we're exhaling, this is also good, like if something like the technology for your presentation goes sideways, this is also a useful trick, so just file this one away. We're going to take a deep breath. Ready? 1, 2, 3. And then when we exhale, we're going to like yell. Like we're going to roar like lions, okay?
Oh, that was great.
Let's do it again. Ready? Just, I call it getting the gunk out. That feels pretty good, right? This will be a useful tool for you going forward because you will have moments where you're going to be hard-pressed to remember why you shouldn't want to pinch somebody else's head off. You will have moments where patients will have run far, far away. You have probably already had those moments. And I'm guessing that you have already fought like hell to get to where you are today. To have a healthcare provider take you seriously, to really listen to what you're saying, to get a correct diagnosis, to get to this conference. And it feels like you should be able to kind of take a rest, right? To take a deep breath and just kind of relax a little bit and go, and yet that's not exactly where you are. And you're going, shoot. Okay, what's the next thing? So I would like to remind you, it is okay, in fact I would say necessary for you to be kind to yourself. The 5 big tenets that I preach in replacement of having patience is respect, kindness, love, empathy, and compassion. Those are the 5 ingredients that I call the good stuff. And I have little cards that have this in case you'd like to remember it for later. And what I say is when you bring the good stuff to yourself, when you treat yourself that way, then it makes it so much easier for you to give the good stuff to your person. Because sometimes it's really challenging, right? And if your brain gets stuck on thinking, if only I had more patience, if I could just be more patient, then it's kind of putting you in that mentality of like, I'm lacking something. And the truth is, you're not lacking. You're really not. You're doing the very best you can with the information you have in any given moment. And I know that if your best friend was going through this, you would treat that person with respect, kindness, love, empathy, and compassion. You wouldn't give them the negative little talk that nasty little voice in your head tries to give you. So just remember to turn that loose on yourself first, and then certainly turn it loose with your person. When you can do that, you're going to have so much more success. A couple of other good tips for success are don't make yourself a target, okay? That always, you put a target on somebody else's back, usually a healthcare provider. So if something is not a popular idea in your household or with your person, you can say, well, we're going to talk to Dr. So-and-so about that. Or, well, that was Dr. So-and-so's genius idea, right? Don't ever say, like, I think, or because you need to be in a position to be the ally, right? You're going to be the cheerleader. You are on team your person, always, 100% of the time. Then another thing that is really useful to be able to do is to not try to sell anything like it's a trip to Disneyland, which we have kind of a weird tendency as humans to want to do. So, and it's funny because when we do that, we're using reason and logic, right? That part of the brain that's really affected with our folks, where it makes it really tough. And the reason we go back to reason and logic is because it's worked for us our whole lives. But it's not really working for a person anymore. So we don't want to say, come on, you're going to love going to the day program or retiring or whatever this thing is that we want our person to do, that we think it's necessary for our person to do. No matter how great we are at sales, that is a hard sell. And it's just not going to work. And that's really the main thing. If you remember nothing else about today, remember to stay away from techniques that don't work, right? Because it's just a giant time waster for you. And I always feel like you don't really have time for trial and error. You just want to know what works, right? Just skip right to that. So don't try to sell it like it's a trip to Disneyland. And then the little corollary to that is the whole reason and logic thing. It's okay to not know the right words, to say, I need a minute to think about that, to even just have a deer in the headlights look, because sometimes you're not going to know the right thing to say. Sometimes you're going to need a minute to think about it. And as long as somebody's not running into traffic or sticking a fork in an electrical outlet, right, you've got time. So if we're not talking about an imminent safety issue, you don't have to come up with something genius immediately. You don't have to have exactly the right thing to say. And with that in mind, I don't have to keep talking. We're going to kick it over to Marianne. She's going to give you some great ideas. I just wanted to make sure that you were feeling the love in the room right out of the gate, and to know that you are important too.
Okay. So, welcome. And it seemed like, well, I'm going to ask you this. Oh, can you guys hear me? I think it's a small enough group. Can everyone hear me okay? Had anyone ever heard of FTD before one of their loved one was diagnosed? Ever? Anybody? No. And I wondered, how did you guys even know that this conference existed? Who told you about the AFTD? Did you Google?
Yeah.
You went on the computer. Okay. Did you have any trouble finding the AFTD? No? Did you just put FTD in, and then you were like, no, it's not this, no. And then did anyone's doctor or office encourage you to get connected to the AFTD?
No.
Yes? No, not yours. So you had to kind of figure it out. It's not the hard way, but thank God you did. But it's not uncommon. I mean, I had never heard of FTD until I'm a nurse by training, and I work at the Brain Health and Memory Center, and we do dementia studies, clinical trials, medication trials. And back when I started in the early 90s, there was probable or possible Alzheimer's disease. And then there were outlier situations, and those outlier situations were younger people that have what was referred to as mixed disease. But it was really rare, and we didn't see a lot of patients children, friends, and I really encourage you to connect with other people here, other people on the walk, make connections, stay in touch, because it's really through people that are walking the walk who have created dealt with some symptoms and strategies where you're going to get, really, to be honest with you, the most help, or at least strategies. So I want to keep this kind of relaxed, so if at any point you have any questions, just ask me. Okay, so the initial response. You get something, you don't quite know even what the doctor's talking about, but you know something's wrong, right? You knew something was wrong. Of course, it's normal to feel overwhelmed and not know what to do. This is an unfamiliar diagnosis for most, and people feel alone sometimes, which is really upsetting. Next slide. Okay, your first step. Step one is to educate yourself about FTD. Attending this conference is the first right thing, so congratulations. I forget that there is a lot of lingo associated with these diseases and disorders, right? And everyone starts throwing around all these acronyms, and people have no idea what we're talking about. For instance, FTD, frontotemporal degeneration. And then there's PPA, okay? That's primary progressive aphasia, and that is the language variant of FTD. Then there's PSP, which is progressive supranuclear palsy, and CBS, which is cortical basal atrophy, and FTD, MND, frontotemporal degeneration with motor neuron disease, and that's the FTD that's associated with ALS, or Lou Gehrig's disease. So you'll find in your time, with the behavioral neurologist or whoever diagnosed you, when they start, saying these things and you have no idea what they're talking about, it's very important to say, know exactly what is that, and because they don't want to be unclear. You know what I mean? It's almost like you get lazy and you just start talking in the lingo. So please, if you don't understand something, certainly for me, but for many of the professionals, let us know. Okay, next slide. Okay, setting up the team. Okay, so the team is, I'm going to talk specifically about the medical team and the names of professionals that you might have already seen or are seeing. Okay, key though is that you and your family member with the FTD are by far the most important people on the team. I don't want you to ever forget that. Did anyone have any difficulty finding a physician that specialized in FTD? Yes. Okay. Oh, wow. So how did you go about finding someone?
Just a common round and ask a question with someone doctor.
And one doctor led to another doctor, led it to another doctor, led to another doctor. But, and so the reality.
There's that many out there. It doesn't seem.
That's right. Now, larger centers in bigger cities often have more specialists. So sometimes I think it's worth the trip. Certainly for the diagnosis. It seems like people that are here have been through the yes.
Oh, no, go ahead.
Oh, the diagnosis.
You finished.
Okay. No, go ahead.
The hardest part was when they asked what the symptoms were, or what did she, what we thought she had. And they said, we got to be more specific because we don't know which doctor to send you to. Well, there was which was, when you read the stuff on it, it's like, I don't know, it could be one of 5 things. How does a layperson know? Well,
that's exactly right. And a lot of times who you're talking to are people that are kind of the answering the phone type and are just trying to find decision trees about. So, I apologize for that. I think it happens to more people than we realize. Plus, at the beginning of the journey, it's hard to know really what the symptoms are, right? Because sometimes you think people have the ability to control certain things. You don't really think of it as a medical symptom or a medical problem. So I think it's worth kind of going a bit of a distance to at least go through the diagnosis and workup. Yes.
I found out from my doctor, I'm legally blind,
Mm-hmm.
and he just kept saying that he just felt, because I knew something was wrong, he
Mhm.
just felt that it was because of that.
Being,
So he did send me to a neurologist,
Mhm.
and then that's when I found out that I had this was from that neurologist.
Okay, so that was good. So finding a behavioral neurologist or a psychiatrist familiar with FTD is enormously important. It's also important to have a primary care physician that you feel comfortable communicating with and that the affected person feels, because that usually is kind of the quarterback of the team, if you know what I mean.
Right.
That certainly if you're in one system, that person communicates with all of the other doctors. Yes.
Because he had diabetes and ultimately cancer in his kidney,
Mm-hmm.
nobody was listening to what I was saying because they tried to blame the other
One thing,
And I said, no, you're not listening. The behavior is the problem.
Right.
And it's so subtle. Of course, he passed all of the
The
tests.
testing, right.
And with the doctor, he just came out with 99.9% correct.
Right.
And I said, no, look at my nose. The behavior is different. And he went out to lunch with, this is Filipino, 3 cousins who were nurses, and they said, no, it's diabetes.
Oh, see. But did
Because
you,
that's what they believed in.
Right.
right. And your efforts and compassion and love for him and your job as the advocate was to keep pushing.
Yeah, they were wrong.
You
They
were
were
right,
wrong.
and they were wrong. And that's part of the job, too, of being an advocate, is if intuitively you know there is a problem or that the diagnosis isn't correct, go to the next person until you feel that you are in the right setting. Did you have a question?
I was going to say, with my husband, he had one type of insurance that they would send him to the neurologist and get him submitted to the bike accident for him, a major bike accident. One fatal bike accident for him to get the help that he can get to really get the diagnosis.
That's horrible, too, considering an accident has to be the thing that gets you in front of the right person. Yes.
Well, I don't know. I'm a nurse and diagnosed and all that
Okay,
myself.
okay.
But I would just say I've lived in rural areas and I've never seen rural areas do very good at diagnosis. And I've always, for myself, my family, my friends, for the teaching hospitals,
Yeah.
for the diagnosis, the treatment can be done back at
Yes.
home.
Right.
But
The act-
teaching hospitals, it's like a bunch of piranhas jump on you to figure out what's wrong.
Well, I think they have advanced imaging. I think you have the possibility of research opportunities. So I agree with you. People have come to our center for the diagnosis and workup, and then come once a year, but have a relationship with a neurologist in their area. And that can work too, but for the diagnosis, I think it's important to make sure it's right, because it's an uphill battle and people are misdiagnosed or diagnosed incorrectly. It's also at larger centers, they're often team approach. So there's the physician, there's a nurse practitioner, there's a social worker, and then there are other therapies. Sometimes a speech and language pathologist is helpful if you have the language variant, because the language variant isn't just about speaking, it's about communication, it's about understanding. And sometimes there are ways that a speech language, through therapy, that can be improved, and that's really important. A physical therapist is another important medical professional that can help avoid falls and balance and umbrella of FTD is motor disease too. So there are some people that have behavior problems, some people that have language problems, and some people that have movement as the problem. And they're all under the FTD umbrella. So for those patients, physical therapy can be really helpful. And then a neuropsychologist. Has anybody had any experience with a neuropsychologist? Okay. So what a neuropsychologist does, and what's important to know is not every patient requires a neuropsychological assessment to get a correct diagnosis. That being said, it's not uncommon to a physician to say, these symptoms look atypical, which is what we heard today, this morning. I want a neuropsychologist to evaluate the patient. So a neuropsychologist is a psychologist, a doctor, a PhD in psychology, who has specialized training and focus on the brain and neurological problems relating to where the problem is in the brain, how that affects the person's behavior and abilities. And so through paper and pencil testing, that can take, sometimes it's 3 hours once or twice. It's not an easy process to go through. But you can get, the evaluation can show more specifically, why does so-and-so behave this way, or why, do they, are they impulsive, or the symptoms I spoke about before. And it's because that's where the problem is. If the problem's in the temporal lobes, you have trouble with speaking. If the problem's in the frontal lobe, with personality and behavior and judgment, and they think that they're fine. That's what you see. Okay, next slide. Okay, so here now we're going to talk about the roles. So the roles are, the patient is number one, nothing about us without us. And that is extremely important to remember, that the patient should be involved to the best of their ability. That being said, if somebody doesn't think there's a problem, then that presents a big challenge to cooperating, right? So the medical compliance piece is about if a doctor says don't drive, okay, then the hope is that the patient will say, okay, well, that's the reality. If you don't have insight and you think you're fine and you want to drive somewhere, you're going to drive. But so that's a little caveat around the patient's role. The care partner's role, as you, Bob, have shown us so beautifully, is to advocate, to make sure that the diagnosis is correct. You want to try to keep the patient safe. They're very easily scammed, as we spoke about before, and sometimes judgment is a problem. The care partner also, manages behaviors of, if there are behavior variant FTD. But most importantly is the quality of life. I mean, we want to make this journey the best it can possibly be. Okay, we can't only look at this through the lens of, negativity and loss. It's every day. It can be the best that it can be. Is it always perfect? No. Is that a little bit Pollyanna? Sort of. But this is what we have. And early in the disease, or at the diagnosis point, or soon after that, having a discussion about what is important while the person is capable and able to participate in that conversation is very, very important. What do we value? What do we want to focus on? What's important? What is important? And these are extremely important. Okay. I spoke a little bit about the primary care physician. So I thought it would be helpful if I told you about the roles of these specific doctors, because I think it's important that when you communicate with different doctors, you communicate about issues that they are dealing with, okay? So the primary care physician. Does everyone have a primary care physician? Okay. That's another thing. Everyone says you have to have a good primary care physician. It's not easy to find a good primary care physician, right? So, but it seems like you guys have one. So that person is responsible for the big picture, right? That person sees you when you are sick, or have a cold, have back pain, knee pain. That's a person that does general labs. That's a person that, prescriptions for cholesterol, those kinds of things. This is the person that you usually call first when somebody is sick. And the reason it's important is that people with FTD, or really any dementia, are more fragile than they seem, okay? So when somebody even has a mild viral illness, like a cold or, any kind of mild, you'll see a big change in functioning. So for instance, if someone has a language variant and then one day, they wake up and their language is you just see a big change. Though you want to pay attention to that, because sometimes it could be a minor illness. It could be a urinary tract infection. It could be a cold. It could be a virus. So you want to be careful about, if you're not sure about something, check it out. And that would be the primary care physician. The behavioral neurologist, their focus is going to be on the FTD. Okay, so the medicines, if needed, that are prescribed for FTD, that's what they're going to be interested in. You don't want your to focus on your back pain or your knee pain. You want to focus on the FTD, the behaviors you're seeing, the changes or struggles. Okay. The nurse can often be the first call for information about medications, monitoring disease progression. A social worker is enormously helpful in this journey. They can give community resources. They can connect you with support. And I know I've said this 1,000 times, but if you have an FTD support group, we just celebrated 10 years in Cleveland with our support group. It is by far the best place to get support, information, and creative strategies. So even if you don't live in a place that has an actual face-to-face support, at least give a phone support or the internet, the computer support through the AFTD a shot, okay? Even if you don't want to go, even if you can't go every month, whatever, at least give it a shot. I really mean it. Neuropsychologist, I told you, helps with diagnosis. So a neuropsychologist is really there more at the beginning of the journey. Okay. Okay, another thing that's really important, and I don't know if you guys have already done this, but you want to set up an organized place to keep track of all of this, because you get a lot of information, don't you? So, brochures, this and that, but each physician will have, nowadays, every time you leave a doctor, you're supposed to get a printout of what you talked about, and does everyone get that? Okay. So, and sometimes they're good, and sometimes they're kind of like form letters, I find. So, if you have an organized place for each individual specialist that you see, it's good to get contact information. So, every time when you go to the doctor first, get a copy of their card, get a copy of the nurse's card, social worker's card, everybody's card, and then either take them or have them in this file folder so that you have the access to that information. Find out, ask them, what is the best way to communicate with you? Sometimes you have that electronic medical record, sometimes it's a phone call. And then the other thing is to, when you're at the appointment, set up the follow-up appointment, okay? So even if they say, there's not too much, that we can do right now, say, okay, I'll see you in 3 months, I'll see you in 4 months. Before you leave, get on the schedule, because it's so hard to get in to these doctors. So if you have an appointment before you go. Now, why do you need another appointment? Because we're setting up a relationship. The doctor will get to know you, will get to know the person with the FTD, and you will get to know the doctor. You develop a rapport, and then when you do need some help and assistance, you have that relationship set up. Okay, that's very important. Like I said, everybody, it's hard to get into these doctors, but I think that is extremely important. Is there anything that I didn't cover that I can help you with? Yeah,
I deal with Kaiser, and they're very organized.
okay,
But every, pardon the French, goddamn person that I have to talk to on the phone asks if I'm the person, and why do I have the legal right? And so to get my name as the caregiver and all the coverage, I hung up on a lady the other day. I said, dementia, he can't talk. You get it?
right,
They don't.
right.
They don't get it at all.
No, I know.
I have a suggestion
good.
for you, and I'm cutting in here because
Yeah.
Marianne's part of the Cleveland Clinic, which obviously is not affiliated with KP. So the best thing you can do at Kaiser is to fill out their particular
I
form.
have everything with them, and they're still that way with me.
Okay.
Every form, everything is filed with them.
Bob, it's just,
But, so if
it's
they
a
catch me
problem.
on a bad day, well, can I talk to him?
No.
I
Yes.
said, no, dementia, DEMENTIA, get it?
Bob
And they
is
don't.
on a telephone
Bob is-
education system.
right.
Everybody take a note here, because sometimes, unfortunately,
They don't
people
know.
are not hearing you
No.
on the other end of the line. And I feel like you're giving a master class
Right.
in persistence.
Yes. And advocacy.
And just like
And
when they
I'm-
were
I'm
saying, oh, no,
charmed
it's
for the
this
first 10
diagnosis. And
minutes.
you're
I
like, no.
And you know what? Sometimes you're gonna hang up on the person and you're gonna get to the point of your breaking point. And it shouldn't be so difficult. But with HIPAA and everything, it is.
Well, and that also goes to applying for,
Disability?
Social
Oh, I didn't
Security
get there yet.
disability,
I don't know how to
long-term
get there.
disability, when your retirement stuff starts kicking in, all of that stuff gets mixed up with the dementia.
The good thing though is with FTD is now fast-tracked. So I would recommend going for, getting your disability, because it used to be a total uphill, horrible battle, but now it's fast-tracked. It's recognized as a young onset disease. But it's like another thing, right? Now you have another thing. But you working towards and advocating for him to get connected to a doctor, it is going to eventually get smoother because you're going to be a known person
No, I
at
understand.
that doctor's
I
office.
understand that.
But it's
I feel like
exhausting.
you are going to be known.
Yeah.
Yeah.
Well, I think
There'll be a picture of Bob.
he's really, he's very extremely stressed
No,
out.
if I hadn't stuck to the path, we'd still be in diabetes.
You're right.
Right, right.
Right, and he would be wrongly diagnosed.
Yes.
And the money would be flying out, and.
Over 150,000 already in bills.
Yeah, right, so he's there at the beginning, and it's chaotic, and I see in support groups, I see when people come and they're new, they're frantic. And it used to be, and I'm not saying frantic in any kind of disrespectful way, I would be frantic. But there used to be nobody and nothing. And nowadays, there is FTD, there is the AFTD, and there are people that are going through the same situation, and there is more support. It doesn't necessarily make your situation easy right now, but it is, there's more awareness. There is more awareness.
The other thing is you got to get all your legal stuff done right away.
Yeah.
Right away. Because you couldn't do what you're doing now without all the paperwork.
Right.
Right.
I was like right there on the line because I went to the neurologist and he said that she should be in a home. She can't take care of herself. She's dangerous. And that's when I got all my paperwork done. The next day when I got the paperwork from the doctor, I would have had a problem because she couldn't sign it.
You mean for disability or all the legal stuff?
Everything.
Yeah.
Everything.
Disability, I didn't let her work for 5 years because I was taking care of her,
Yeah.
so she didn't qualify for disability.
Okay,
Oh.
right. The financial toll is just a whole
So
nother.
you've got to get all that paperwork
Yeah.
right away.
And you have to get to an elder attorney that understands not just dementia, but FTD. And sometimes the legal protections require guardianship. Have you guys heard of
Yeah,
guardianship?
beforehand,
Where you-
conservatorship.
Yeah, it is actually, yeah.
So I've got, just looking at the title of this, the doctor was FTD, now what? I was thinking more
Okay, okay.
So this could be my future.
Yes, yeah.
So what do I do legally so that I get locked up before it become dangerous? And then secondly, what can I do to slow this process as much as possible? So there's been a lot of focus on caregivers.
Yeah.
But what about people that have the diagnosis? What are the things that we can do while we still have
Your
capacity?
abilities, yes, right, and important decisions need to be made, that's exactly right. So I would consider, have you heard of the research study Artful?
I'm in it.
Okay, awesome. And then, so you were tested, had genetic testing as not part of a workup or family
Right.
history?
Well, a sister was.
Okay, okay,
Had it,
and so.
and my father died.
Okay. So, you know, I think, again, you have the ability to set up some legal safeguards for yourself and for your family. So have you seen an elder law attorney?
Not yet.
Not yet, okay.
So I'm trying, that's a.
Yes, yeah.
This was just.
For your own protection, you gotta do it.
Yeah.
Yeah.
And
On
also
the-
for protection of
the-
whoever's gonna be there
The
for you in the future.
AFTD
Right.
website,
Pardon?
the AFTD website
Well,
has a section
Okay.
on, I'm trying to think what it's called. Is it
Legal.
planning or legal?
It's
But
just
it
legal
covers legal
information.
and,
Okay.
yeah.
Good.
And also at the AFTD table, I'm one of the staff at AFTD, we have a green booklet on there, and it's called The Doctor Thinks It's FTD, Now What? And you'll find a list of, there's a checklist of things to be thinking about once you have a diagnosis, everything from legal to long-term planning. I think in terms of what can you do, you know, we'll always tell people it's all about your brain health, being physically
Yes.
healthy, eating healthy. What we would ask anyone to do, regardless of any diagnosis, the best thing you can do for your own self physically is to stay as physically active as you can and eat as healthy as you can.
Right.
For your own brain health, for everybody should be doing that.
And that's evidence-based. That's not just good advice. That's evidence-based. The other thing is blood. If you have high blood pressure, and this is for all of us in the room, take your blood pressure medicines because there's definitely a relationship between untreated hypertension or just hypertension and brain problems. And there is going to be a breakout. It's not really a breakout. What is it for people that have? Well, I guess that wouldn't apply to you. Don't have FTD. Okay, you just have the genetics. Okay.
I'm not sure the next session.
Okay.
But yeah, there's plenty of resources at AFTD's table. So if you haven't already gotten the booklet, you did. Because it really has a wealth of information, specifically when there is that diagnosis and there's so much, it's overwhelming, you don't know where to start. And the other thing to keep in mind, especially for folks in rural areas, is to, when you're looking for local resources, if there isn't a support group locally, it's also looking at like early onset dementia in general. So if there aren't, I know Marianne mentioned like finding experts in FTD, and sometimes you can't find them. So if you can at least find someone with early onset dementia experience, at least as a starting point, they're going to have more information for you than somebody else perhaps, because you can't, they're hard to find. They're very hard to find, the experts. So that's another reason why the support groups are so important. Even if you can't go to a support group, but you know there's one 2 hours away from you, you can still call that support group facilitator and say, look, I'm looking for this. Maybe there's a member in that group who either lives near you or lives in between where you are and the group meets that can provide you information on a primary care doctor or a therapist or a geriatric care manager. Sometimes families are so overwhelmed or they don't live in the same area as their loved one. Although there is a charge, there's a fee, but there are geriatric care managers who can help support the family members in helping when you're at that point where you need to think down the road, like what are we going to do next? When can we no longer care for our loved one? They can help with that whole process. So there are folks, and of course AFTD's helpline. You can always call our helpline.
One of your best resources is somebody that's already been there.
Absolutely.
Because they know the path.
True.
Yes, and they'll be able to tell you too, oh, this is a great facility, or this isn't, or this is a great doctor locally, or whatever. Whatever you're looking for, don't ever hesitate to reach out to that closest support group facilitator that you can find.
I would say that a couple of things to keep in mind. One, please don't try to sprint through this because it's really a marathon and you're just going to get like injure yourself, right? If you're trying to sprint through it. Ask for help. It makes it exponentially easier. It really does. And then just going back to Bob, because I'm so moved with just the emotion pouring out of you. And I think that, I think most of us really can relate
I'm not
to
allowed
that.
to do that at home, you see.
Okay,
And
well.
I am charming at home. And I do sell to the rich, and I'm low-key and charming. But this is the first place I've walked in where everybody knew what the
I know.
fuck FTD was.
I know. See, that's it, right?
Somebody says,
I love
oh
that.
yeah, or somebody, I've only been going through this for 6 weeks.
Oh,
I thought it was diabetes.
okay.
I thought it was kidney cancer. No, it's, who knows what it is? Nobody.
Okay.
So this is the only place I can yell.
Yeah, well, I did
I
find
don't
you
yell
quite
at home.
charming when I was talking to you right before we
Low-key charming,
started.
and I hug the dog.
What I wanted to say
6 weeks. I'm a virgin, right?
What I wanted to say is that for all of us, as frustrating as it can be, as it has been, as we see, as it is,
Right.
please know that you are going to, encounter people, of course, on the phone or face-to-face or whatever that seem completely clueless. And what I would ask you to keep in mind, family, yeah, people that want to have Thanksgiving with you. What I would ask you to keep in mind is that things don't change until we let people know that it needs to change. People don't know what they don't know, right? There was a time when nobody in this room even had heard of FTD.
Right.
And so when we use our voice to let people know, like, this is not acceptable, or I need it to be this way, or when you're talking to my person, I need you to talk to my person like they're a human being, not a potted plant, right? Those types of things. I'm sorry, there are going to be days when you feel like you got nothing left, but you're going to have to be the one to pipe up because you're there and you have the ability to say something. And that's how things change. So, rock on, warriors.
Right.
Are there any last minute questions? We have a couple of minutes left.
Yes.
Yeah, my sister was recently diagnosed, but she's, all her life has been she's never been married and she doesn't have children. She's always been very private and, even though there's six kids in our family, she's the oldest sister. She didn't do the things with us other sisters that we used to do when we were little kids. So anyway, we respect her being different, probably on the spectrum if you didn't look at her as a 5-year-old. Now that she's 62. But part of it is, now that we know her diagnosis, is figuring out how do we get to figure out how do we interact with her and how do we set boundaries and how do we gain her confidence and get so that she can trust us to help her and we can learn how to help her. So when she asks me a question and I try to explain it to her and she yells at me and tells me I'm nothing stupid and I don't know what I'm talking about, I was very good. I didn't react to it. It pissed me off. And I was just like, I just drove an hour and a half to get here and I'm just gonna chill. But how do I learn, where do I go to learn how to deal with somebody who I don't know what I'm gonna get?
Right.
That sounded like classic
Well,
support group stuff to me.
That's so classic. Every
Yeah.
single word that came out of your mouth was 100% accurate and true, and it's the problem. It's the problem. How do you try to help somebody who doesn't think they need it and is kind of unreasonable and they're not willing to, well, and they're not capable. So explaining and all that stuff, the reasoning approach, which we all do all day long, doesn't work. So it's getting information from the AFTD, the information to learn more about whatever specific type of FTD she has.
It's PK.
Oh, she has primary progressive. Okay, and then get connected to, a sport group, which I know you guys are probably like, stop saying that.
Yeah.
You're doing that?
Yes, and
Good.
Dr. Simona Riley did her diagnosis.
Awesome.
So it's, I think what it
She's in
is,
a great place, but it's just for us
It's
to
hard,
figure out
right?
how to
it's
interact
so
with her.
individualized.
Yes.
So you can certainly call our helpline and you can tell us what you have, what is your situation right now, what is the biggest challenge, and we can share ideas. But, in my mind and in my opinion, it's trial and error. You have
It
to
is,
keep trying
right.
till you figure out what works for your sister, because what works for your partner will not work for your sister.
Right.
It's so individualized as a diagnosis. And what you're gonna have to do is learn for your sister. What might work for your sister today when you talk to her will not maybe work tomorrow. And it's so individualized. And the hardest part that I hear from loved ones and caregivers is, God, I'm so tired of them being, I did all this for her and
Right.
I get nothing
Right.
back. She treats me like, like what is going on? And it's really hard to take that in and to not
Right.
take it personally. And the thing to leave here is to remember it is the diagnosis, even though it's hard to hear. Like your sister, we'll have people say, my husband would have never said this to me. He
Right.
was the kindest, most gentlest person I've ever known. And then he turns around and he's saying,
Right.
things that are hurtful and mean. So it's keeping in mind, like, it's the diagnosis, it's the disease, it's not the person. The person is changing. And to try, as hard as it is, to not take it personally.
I mean,
But
she
it's-
has, a couple of times, we mostly communicate by text because it's easier
Mhm,
for her.
sure.
So she can study those words.
Oh,
short,
right,
keep it
right.
simple and short.
Yeah.
And she's actually said thank you.
Oh,
And we've actually, my youngest sister is a hugger, and so we get hugs now that we've never in our lives gotten a
Wonderful.
hug.
Yeah, it's those special moments. It's just treasuring those moments.
So there are
Yeah.
some things that when she shows me, she prints out the ad that she got in her email for the iPhone 8 and wants to know what that's for. We're trying to explain to her it's an advertisement, we're not to do anything. And then she gets upset because she thinks we need to spend $850 for this thing
So-
where her phone won't work.
Yeah, I mean, and one little tidbit that we always tell people is fiblets are okay. It's
Yes.
okay if, you know what, you have to tell your sister, we don't have the money for it.
We don't have-
Whatever it is, like
I'll take
it's
care of it,
okay.
just give me the paper and I'll take
Or
care of it.
redirecting. It's
yeah.
redirecting her. So let's talk about, okay, maybe, we'll talk about it later or, whatever. It's okay to kind of say what you need to say to make the experience, to either calm them down or redirect them another way so that hopefully they'll forget about it for a while. It's so individualized and it's trial and error and seeing what works and really trying to redirect. And you do honestly, it oftentimes becomes like you're treating them like a child. And even though you might say, stay away from the stove, it's going to hurt you, you have to go back tomorrow and tell them again. Even though if it's a child, they learn from that and they'll remember that. So it's that same concept of like, it becomes to the point where no matter what you tell your sister, it's too expensive or you don't need it, you have a phone. She doesn't grasp all of that. And so,
Keep an eye on the gas stove and the microwave.
Right, and you develop a thick skin. As caregivers, as care partners, as family members, you give a lot, and unfortunately, because these poor people are ill, you don't get a lot in back. And so you do it because you know your sister needs it. And the fact that you're willing to drive 2 hours to see her, to kind of have her, to have her, is a testament of you. It really is. And that is the right way to, you're just one thing at a time, you hang in there, you try, just like you said, you try not to take it personally, but you know what, it stings. And it's upsetting when somebody does these things and says these things, and she looks like your sister. If you could see on the outside what was going on in the inside, we would have more compassion and understanding, and everyone around us would do the same. The reality is these poor people have a condition that nobody can see on the outside. It's easy to forget. You're doing the right things, and you just keep doing the best you can to move forward, and don't give up. And not congratulate yourself, but recognize what you're doing. I mean, taking this on is an amazing gift of love you give another person. I mean, what better gift can you give another person than to help them when they're, it's not easy. So.
Yeah, and usually you're not going to hear thank you, so that was kind of miraculous right there. But usually you're not going to hear thank you So consider thinking what's going to be a meaningful thank you for you. Is it, a nice lunch out? Is it a spa day? Whatever. Because you're going to need to step up and give those thank yous to yourself. And again, if it was, just like Marianne was saying, if we were talking about a compound fracture of a leg, everybody would go, oh my God, that's like a ankle to hip
Can I open the
cast,
door for
holy
you?
cow.
Right.
Yeah, very accommodating because we have a visual cue.
Right.
Whereas here, that, looks just like they did before there was any symptom. So you really need to step up and say thank you on behalf of your person for yourself,
Right.
and spoil yourself a little, because it won't feel like spoiling. It really won't. But you deserve it. You need to have those moments too where you're feeling good.
Your loved ones are
Yeah.
the lucky ones. That's the
Everybody
thing.
says that.
Your the loved ones are the lucky. Do you know how many people are probably in jail that have FTD that have nobody? Or how many people, lose all of their relationships? I mean, there are stories I could tell you even from my own experience that would just shock you.
Curl your toes,
So
yeah.
remember that. Your loved ones are lucky, fortunate, and you guys are exceptional. Okay? And that's how we'll end. And if I can help anyone in any way, come up after or later.
Yes, thank you. So we have a couple more sessions. So we have a quick break before I think we all meet. I have to be honest, I haven't looked at the